Hi, Tanya from Created Health, Nutrition and Fitness. I want to talk about male preconception and fertility nutritional consults. These are just as important for our men as they are for women. Predominantly, I see more women than I do for men, but men are just as important for their preconception and fertility nutritional consults as it is for women. And the reason behind this is because every 90 days men are producing new spermogenesis, and our diet and lifestyle influences the quality and quantity and health of sperm. So I thought I'd talk about the importance of taurine. So what actually happens within the brain is the hypothalamus, and the hypothalamus produces your gonadotropin releasing hormone GnRH. Now taurine is actually needed to stabilize the excretion of GnRH. So this is where having a nutritional consult is really important to make sure that you are hitting those levels of taurine that you need. Now, once the gonadotropin releasing hormone has been released from the hypothalamus, it then has a cascade effect, and that then stimulates the anterior pituitary gland within the brain, which then releases two other hormones. It releases LH, luteinizing hormone, and SFH, follicle stimulating hormone. And you need the taurine in order for this cascade to happen effectively. Now, these two hormones then stimulate the development of the follicles within the gonads. Now, the follicles, so you need the taurine for the hypothalamus production, and then you also need the taurine to balance out and stimulate the LH and FSH production, so that the follicles within the gonads then get stimulated. And the follicles within the gonads, they then release two different sex hormones, and the two that they release are estrogen and testosterone. So taurine is also really important in the physiology of the sperm. So it's needed, taurine is needed for the motility of the sperm, so the sperm's ability to swim and move, for that phalange to be able to move. And also taurine is needed for the sperm hyperactivation, so which occurs during sexual intercourse. So you need to make sure that your taurine levels are not only giving the sperm that motility, but also that hyperactivation that is necessary. Taurine also gives the sperm the ability to penetrate the outer layer of the oocyte, and so the taurine's needed for the penetration, and also once that penetration happens, for the fertilisation. So as you can see, just that one mineral is really important when it comes to male fertility. Another reason why you want to make sure you're getting adequate intake of taurine during your preconception care and fertility period is taurine inhibits the sodium potassium ATPase, which is a active transport pump within the body. And what this transport pump does, it hydrolyzes APT and moves ions to a concentrated gradient. And this is really important because it increases the sperm fertility ability. So your ability for fertilization is increased when your taurine is adequate, because this gradient reduces the amount of potassium that is found within the fallopian tube, therefore increasing the ability for fertilization to happen. And of course, for women, this is also really important because we need adequate taurine for the implantation to occur, and for the oocyte to come down that fallopian tube. So as you can see, your nutrition is really important for men just as it is for women when it comes to fertilization and preconception care. I do see predominantly more women than I do men when it comes to preconception care. More men are starting to understand the importance of their nutrition during this period. So if you are planning on starting a family, it is advisable to have a preconception and fertility nutritional consultation prior to this, and for men this is 90 days prior to conception. So if you are in that window, please reach out. I would love to help and support you and your future baby. I'm Tanya from Created Health, Nutrition and Fitness.